In this video I'm going to tell you 5 very important points you should know before you go through an abdominoplasty. My name is Dr. Alawi, and on this channel we speak about plastic and reconstructive surgery. The plastic surgeon. The abdominoplasty, or tightening of the abdominal wall, is a very popular procedure in plastic and aesthetic surgery. My name is Dr. Alawi. On this channel we speak about plastic and reconstructive surgery. Don't forget to subscribe to this channel if you like this video. So point number 1 is the different approaches for tightening the abdominal wall. First of all, you have the classical horizontal abdominoplasty. This is a procedure which is used in more than 80% of all procedures. In this case, you just take the approach in the lower part of your abdomen. By using this approach, you position the scar into the bikini line. So nobody can see the scar and it is not visible. So the planning of the scar is very important here. Normally a repositioning of the belly button is needed by using this approach. Another frequently used approach is the fleur-de-lis abdominoplasty. So that's some kind of reversed T abdominoplasty. So if you aim to tighten the abdominal wall in the lateral part of the abdomen, you put in another scar in the midline of the abdomen. So your plastic surgeon have to analyze exactly in which parts of your abdomen a tightening is needed. Most of the abdominoplasties are done with a horizontal abdominoplasty in over 80% of all cases. Another approach to do an abdominoplasty is the classical mini abdominoplasty. So that's also an incision in the lower part of the abdomen, but here you don't mobilize the whole abdominal wall in this area. In addition, we have to analyze and see if you have an rectus diastasis. If your muscle, the rectus abdominis, is going apart from each other, you have some kind of diastasis in this area. So another really important point is to analyze if the patient have an rectus diastasis. If it's so, we can do an rectus application, so we can tighten up the abdominal muscular part in this area. The second point, and that's a separate point, you should always discuss with your plastic surgeon where the scar is going to be and which kind of approach you wish to have. With all those different approaches, different scars will appear. Also, there are some surgeons combining the abdominoplasty with liposuction. In my opinion, you should not do that in the same procedure. The reason for that is that by mobilizing the abdominal wall, you compromise the vascularity in this area. So you can have some kind of blood supply disturbances if you mobilize too much of this tissue. If you combine a liposuction with this procedure, you have the risk of necrosis, so areas of the skin which are not getting so much blood. So if you plan to combine an abdominoplasty with a liposuction, I would not recommend it. But after 6 months you can plan a liposuction separately to the abdominoplasty which was done. Some surgeons do this combination of abdominoplasty and liposuction in the same area. I would not recommend it. In my opinion, the risk is too high to get problematic areas with blood supply. So another very important point is the risk of seroma. Seromas are some kind of collection of fluids which can appear after the surgery. So there are some modern techniques using some kind of new suture techniques to lower the risk of seroma. So in the literature, the risk of seroma is about 1 to 40%. So the techniques your surgeon is using is really influencing the rates of seroma in this area. There are some modern techniques using progressive tensure sutures, adapting your abdominal wall to the muscular part of your abdomen. By using this technique, it could be shown that the risk of seroma is getting very low. Not every plastic surgeon is using this tension progressive sutures. So ask a surgeon if he's using this technique. Point number 5, and that's a really field complication, is the creation of a venous thrombosis. By creating a venous thrombosis, the risk for damages to the body is really high. In some cases, patients can even die from getting a venous thrombosis, which is getting to the lungs. So the highest priority is here to prevent to get a venous thrombosis. To prevent this risk of getting a venous thrombosis, you should stand up early and walk after the operation. You should not walk too much, so the blood pressure is getting high and you're getting the risk of bleedings, but you should walk and go around to lower the risk of getting a thrombosis. Yeah, I hope you liked this video. These are really important information you should know before you consult your plastic surgeon and before you go through an abdominoplasty. Don't forget to subscribe to this channel and leave a comment and a like on this video. See you on the next video. Dr. Alawi.